Hi everybody, welcome back to my channel. I'm Yesha if you're new here, and I thought today I would talk about what are some advantages of academic programs, and then in my next video I'll talk about what are some advantages of community programs. So yeah, with that, let's get started. So the first thing I really wanted to talk about is most academic programs are usually larger than smaller, community programs, and not just in program size, but in faculty number, and just department size overall than usually the private practice side. So really this gives you a number of advantages. The first is usually just the sheer number of residents means there's usually less call. I mean, over 52 weeks in the year, you're going to have more residents to split the call over, but at the same time, having more departments means you might have more rotations that require call. So sometimes those things kind of even out, but I would say overall there's less like ER call and things like that at academic programs just because of the number of residents. The second thing that's also pretty obvious is just like the overall research support that you get, whether it's academic time, but also just the amount of projects that are going on in the department. The faculty have dedicated time for research most of the time. So really there's just a lot more support for research. So if you're interested in doing a lot of research during your residency, or you have a very specific niche that you're interested in, I think academic programs are really the ones for you. And that's not to say that if you are at a community program or a smaller program that you can't find the support with faculty members and stuff or at neighboring institutions, but overall academic programs definitely have a lot more, really have a lot more built-in time and funding and just like overall support for you if you are interested in research. Another thing to think about are the complex cases that you see at larger academic centers. They're usually tertiary care centers, they might be cancer centers, they might be level 1 trauma centers or transplant centers, and usually those cases are much more complicated. Usually those cases are much more complicated than if you are at, in outside facility, smaller community hospital. So you'll see a lot more complex cases at academic centers. That's all I'm trying to say. Overall, you might even have some more like academic time or study time because you're not always expected to read the same volume of cases that you would be seeing at residency programs that are based out of private practices, because usually there's no pressure to clear the list. You might have like 8 people on one service at a time rather than being like only 1 or 2 people. So overall you have a little bit more like relaxation. It's not quite as stressful. And again, before like people start commenting like, no, my program isn't like that, every program is different and you'll have to assess, how each program is. But just kind of in general, there are so many people on one service at a time that usually it's less cases overall than you would see at a private practice. But the cases themselves will probably be more complicated, more complex. Other things to think about are like specific tracks that you might be interested in, whether it's informatics, whether it's research, whether it's like clinical educator. You might have those opportunities at a larger academic program that you may not have at community programs. And then of course just name recognition when it comes to getting into other fellowship programs that you want or getting a job that you want. The name recognition does come into play sometimes. And then also just the larger alumni networks will help get your foot in the door in other places if you are looking at specific private practices in the area, or if you're looking at other things. That larger alumni network can, I know someone, or I know someone at that practice, they can give you insight or something like that. Those larger alumni networks can really help get your foot in the door for whatever job or fellowship it is that you want. So just things to consider when you are looking at programs. There are some advantages that come with academic places that are really large. And then of course in my next video you'll find out what the advantages are of smaller community hospitals. So hopefully that was a helpful video, and I will see you all in the next one. Bye. Another thing